you, Richmond. I appreciate, I've been learning and listening, and I appreciate everyone coming out to these. It's always great. I think, you know, with all the cities I represent in West County, Richmond's the only one that has this neighborhood council structure, and it's great. And I used to be president of Marina Bay Neighborhood Council way back in the late 80s or early 90s, so I know how vibrant the neighborhood council structure is. Before I get into what I was going to talk about, since there were a few questions on the drought, I used to be on the East Bay Mud Board way back in the 90s, and so they're the ones that will have drought restrictions in place that will cover Richmond residents. They do a great job at it. They always have very aggressive conservation programs, and they actually have had in the past, I don't know if they have now, programs where you can get rebates for doing certain things like, you know, water efficient appliances, landscaping, things like that. So it's always great to inquire. And Lisa McIntosh is the elected director who replaced me, and she's still on the board there, so you can always talk to her. So I came to talk about healthcare in West County and Doctors Hospital and what is happening with doctors, and by now you've probably read that it is scheduled to close next week. So I wanted to talk broadly, not just about doctors, but what's going to happen after. And I handed out three things. My dad was a high school civics teacher. He taught me to always bring handouts. So, right. So three things, and I'll just make reference to them. You can take them with you. One is a chronology of Doctors Hospital. I always think it's important to sort of see a history, and there's a lot of history here. So there's that. There's another handout that says Contra Costa Health Services and West Contra Costa. So it's all the various health services that Contra Costa County Health Department provides in West County. And then there's this two-page flyer that was just put together that is going to get wide circulation about healthcare in an aftermath of Doctors Hospital closing. And let me just start by saying, I think it's really an unfortunate statement about how healthcare works in this country to have a really important hospital and emergency room close here in West County. And sort of to explain some history, there are two public hospitals in Contra Costa County. Doctors Hospital, which is an independent healthcare district that covers just West County. And then there is Contra Costa County's hospital, which is located in Martinez. And then, you know, there are private nonprofit hospitals. So in West County, there's Kaiser, which is a nonprofit, and Doctors. And Doctors Hospital was set up back in the 1950s as a healthcare district. And since about the 1990s, it has been losing money. Why is it losing money? So payer mix is really important in all of this. So 80% of the patients at Doctors Hospital are Medicare and Medi-Cal patients, 10% are uninsured, and 10% are commercial pay. People like me, I have health plan. The federal government pays Medi-Cal providers 60 cents on the dollar. So think about that. If you're providing Medi-Cal services and you get reimbursed Medicaid under the federal government words, Medi-Cal in our words, they pay about 60 cents of the cost of providing service. Medicare is a bit higher, it's about 80 to 90 cents. So if you're losing money on those 80%, you can run the most efficient hospital and not make money. You're going to lose money because you're getting paid less than the cost of providing service. There's been a lot of effort and a lot of work for many, many years, including by our former Congressman George Miller, to try to change these Medicare and Medi-Cal reimbursement rates. And that has not been successful. Back in the late 90s and early 2000, the healthcare district gave the hospital to manage to Tenet, which was a for-profit healthcare system. And from about the late 90s through 2004, Tenet ran the hospital under a contract with the healthcare board and lost, after investing tens of millions of dollars, also lost money and said, we don't want it anymore, and gave it back to the healthcare district in 2004. And that was the first of the parcel taxes. So in 2004, the healthcare district put a parcel tax on the ballot that passed. It was $52 a year, raised about $5 million. But in 2006, the hospital was losing about $36 million a year. And it filed for bankruptcy and was about to close, and that's when I got involved, was in 2006. And I advocated at that time for the county to help arrange financing, provide some funding to keep the hospital open. The county runs its own health system. 170,000 people in Contra Costa County are enrolled in the Contra Costa Health Plan. The county has 11 public clinics, 2 of them in West County. The West County Health Center, which is the largest health clinic in West County, is a primary care, right? If you think about healthcare, you've got emergency care, urgent care, and primary care. We mostly get our healthcare right through our physicians in the doctor's office, which is primary care. Sometimes we need urgent care, sometimes we need to be admitted into a hospital. So the county's two clinics are in North Richmond and in San Pablo. And then with the passage of the Affordable Care Act, more people have enrolled also in the county's healthcare system. So the county provided some funding. At that time it was $10 million, got about another $10 million from the federal government to keep the hospital open. But over the course of years since 2006, the hospital brought in interim management, who were specialists in turnaround. So the loss at the hospital was cut from about $36 million a year to $18 million a year. Another parcel tax was passed in 2011. It was $47 a year, also raised about $5 million. For a few years, Kaiser and John Muir were putting in about $5 million between them. Kaiser did that for 4 years, $4 million a year. John Muir did $1 million a year for 3. The state was putting in for 4 years, $12 million a year. That's how the gap was closed. The state funding went away, Kaiser stopped putting money in, counties continued to provide cash advances to keep the hospital open. The hospital started issuing bonds and basically borrowing off its future property tax revenue for operations. Normally you borrow off future revenue for capital, but it borrowed to keep the hospital open. There was a lot of work to look at being a part of a larger system. We actually talked with UC San Francisco about maybe merging the county doctors into the UC San Francisco system. It didn't work out. There was a lot of work to look at other systems. You're seeing right now with the Affordable Care Act mergers of systems. Like you may have heard that UC San Francisco has basically taken over Children's Hospital in Oakland. My physician group, which is private physicians, their offices are in San Pablo and Pinole, were purchased by Stanford. So what does that mean? That means I have to tell my doctor if I need inpatient, I want to go to doctors, otherwise they'll send me to Stanford, because they've been bought by it. So the Affordable Care Act is causing an integration of health systems, physician groups, hospitals, and mergers. So we thought that would open up some opportunities for doctors, and it hasn't. So doctors continues to lose between $18 and $20 million per year, and has to meet a state requirement by 2030, seismic requirement to build a brand new hospital. That's which would cost in excess of about $200 million. So all of these things combined, the hospital is right now in pretty significant debt. So the 5-member healthcare board, they're a 5-member elected board, made the decision that it is literally running out of cash, has no real cash available, and voted to close the hospital as of April 21st and use the money that it has to pay off the obligations it has to its employees, the retirement plan for its employees, the benefits to its employees who worked hard, to pay physicians and vendors and all of that. So what does that mean for West County? So it means the closure of a 25-bed emergency room, which means we are left with only Kaiser's emergency room, which is 15 emergency room beds. Remember I said there's urgent care, primary care, and emergency, urgent, and primary care. So at Doctors Hospital, about 10% of the patients who went into the emergency room ended up being admitted. About more than half the patients needed primary and urgent care, slightly less than half needed emergency care. So going forward, there's going to be a gap. But to try to close that gap, so the county has been working with Lifelong Medical, which used to be the old Brookside Clinic. It's a large clinic system, nonprofit clinic system, and they are going to open an urgent care facility across the street from the hospital for people who need urgent care. Like last time I was at Doctor's Hospital emergency room was I broke my finger, and that's the kind of thing you could get in an urgent care, but heart attacks clearly is not, right? That's an emergency room, so people who have heart attacks would go to Kaiser or Alta Bates or John Muir or county, things like that. So there will be an urgent care facility. It's on this sheet that I handed out. There will be an urgent care facility opening across the street. The county is continuing to extend its clinic hours to get more people into primary care, because clearly that's the best place to get primary care is in a doctor's office, not in an emergency room. So get people who need primary care into their appointments and expand clinic hours. One of the numbers that, and you'll see here all the various healthcare, some of the various healthcare providers on the back. The other thing that's being publicized is this 24/7 advice line, nurse advice line. Anybody, even if you don't have health insurance, can call the county's 24/7 advice line to determine where they need to go if they feel they have a medical issue. All of us in our health plans have an advice line, but if people don't have health insurance, they can call the county's number, and it's available 24 hours a day. So that's the short sort of presentation of this, and I want to be able to answer questions that you have. It's so what will happen is the healthcare district will continue in operation because it collects revenue, which is paying off all of its debt. The 2011 parcel tax will go away because it sunsets if the hospital closes. So the only parcel tax that we will all be paying is the 2004 parcel tax, which is $52 a year. Again, the $47 a year parcel tax from 2011 will automatically sunset and go away because it was tied to the hospital being open. The 2004 parcel tax will be paying off debt for many, many years. Eventually, when the hospital pays off its debt, well off in the after 2020 or beyond, then you can use that revenue for healthcare services in West County. So that's the reason why that board will stay in existence and that healthcare district will stay in existence. And so the county's role will be to continue to increase clinic slots here in West County. The urgent care, Lifelong Medical providing urgent care. I believe there'll probably be an ambulance will be parked at Doctor's Hospital somewhat for a while if someone walks there. Because right now the emergency room is only open to walk-in, it's not open to ambulance traffic. So if you walk there and believe you need emergency care, and you do, there'll be an ambulance. I mean, that'll be something that is there. And so that is, as I say, it's unfortunately a statement about the unfairness of the way Medicare and Medi-Cal reimbursements work. Because for many hospitals that have 50–60% of their patients Medicare and Medi-Cal, if you have more commercial, it offsets that. There was some rumor going around that Alta Bates was going to close by 2030. We checked that out. They have not made that statement. There was some article in a newspaper in Berkeley about that. All hospitals in the state that don't meet seismic requirements are going to need to either be retrofitted by 2020 or rebuilt by 2030. Kaiser Hospital is new, so that meets seismic requirements. The county's hospital, Martinez, meets seismic requirements. I don't believe Alta Bates in Berkeley does. So you'll see there's a big challenge ahead just on that as well. So I'll open it up to questions. I just wanted to put out that information. As someone who has spent 8–9 years trying to help keep Doctor's Hospital open, it has been very frustrating to see us at this point today. I think had we not stepped in 2006, it would have closed back then. It has run up tens of millions of dollars more in debt since that time. Did get financial support again from Kaiser, John Muir, stayed for a while, that went away, but ultimately it's sort of, a commentary. You are seeing hospitals all over this country and all over the state with this payer mix and with the low reimbursements closing. And the effect of that is less emergency room beds in communities, which then means, and my father died of cardiac arrest. I understand how quick the time to get care is really how important that is. A few minutes later, and you die. That's what happened to him. He was revived, it was too late, he was brain dead, in a coma for 10 days. Had he gotten care earlier, he would have most likely lived. So that's so important. So, questions?
Same to me, exactly
Yes.
the same thing.
Question.
Yes.
So what's the plan for the building? Is it going to be torn down? What are we going to put in its place?
So the healthcare district, which owns the building, the healthcare district is selling off the office buildings across the street to get the city of San Pablo is buying it, and it's going to use that money to help pay obligations as it closes. For the building itself, I don't know if it's, I can speculate, but they haven't made any decisions about the building itself. I think they're going to continue to get tax revenue to pay off debt. At some point, do they consider selling the hospital site itself to pay off debt sooner, and then which would allow them to get, to the extent that they pay off their debt sooner, they can then get the cash flow from property tax revenue, which is $5 million a year, and use it to support probably other more expanded urgent care, other services, things like that. But right now, I don't think they've made any decisions about that. That hospital site is across the street, as I say, from about a block from the county's health center, and it's near the casino. There's been a lot of discussion. What does the casino want? In reality, casino probably would love to buy that at some point for parking. Under federal law, the casino cannot expand. It takes an act of Congress for that casino to expand, but they've been buying up all the parking around it because they clearly need more parking. The city of San Pablo probably views that as an opportunity for economic development on that site, because to the extent that a lot of people come to that area, to the casino, do they build something for economic development for the city? So the hospital district doesn't need to sell the site. The question is, is there going to be a hospital there in the future? It would take hundreds of millions of dollars to get a hospital back up running again. So I haven't heard that there's any immediate plans for them to sell it. They just have sold the property across the street and a portion of the parking lot of the hospital. A portion of the parking lot too. Yeah.
I know that.
Yes.
I know that there are 5 supervisors.
Mm-hmm.
You only have 1.5
For
on
West
West
County.
County. What would have happened, this is in the past, so
Mm-hmm.
if the other 3 in the East County would have just said, well, okay, let's put it under the health,
Yeah.
and that would be under the whole thing.
Right.
So it wouldn't have to close. What happened?
I think had the parcel tax in 2014 passed, I mean, that was the very expensive parcel tax to close the gap. I would have maybe had support on the board to do that, because it would not have had this big gap. And because I think making it part of a larger system made sense. Clearly, there was not a majority of our board that was going to take on the liability of running the hospital, given its $18 to $20 million a year loss. So, in fact, the county health system has been struggling on its own. I mean, right, it's a public system. The Contra Costa Times did an investigative story a few years ago. The 2 hospitals in this county that provide most of the charity care and care to people who are indigent, lower income, than the county hospital and doctors. And so it's been struggling itself. So we would not have had support. What I did raise to the board, and we did a poll, is I suggested we look at a countywide sales tax measure that would have been a broad measure for health and public safety.
Right.
That's what I was supporting. So we did a poll. So Alameda County has a half-cent sales tax just for healthcare. Just for healthcare. And it raises $100 million a year. It takes a 2/3 vote to pass a special tax. So we did a poll. I thought, okay, well, let's try a general tax, which is only a majority vote, and use it for general purposes, which would include healthcare, public service, public safety. We barely got above, just right around 50%, which no way were we going to pass it. It takes 4 votes of our board to put a sales tax measure on the ballot. I only had 3 votes to do the poll, right? And we got the poll results back, and we were at 52. You need to start much higher to get a majority. If you know anything about measures in this county, and I've been involved with transportation measures in the past, you need to have a higher. So there was not even countywide support to do a general sales tax in Contra Costa. It would have cost us $1 million to put it on the ballot and all of that. So that, even had we got a 4th vote to put something on the ballot, I doubt we would have passed. So many counties like Santa Clara and San Mateo have general sales taxes that you use for many purposes, including health, not just health, but other things. We don't have that. We do not have a sales tax. Richmond has 2 sales taxes. Contra Costa has 0. You have a utility tax. The county does not have a utility tax. We can't get that passed. There's been comments, do we do utility tax? It takes a 2/3 vote. I raised that several years ago. It takes a 2/3 vote to do a utility tax. These are really hard to pass. So that's sort of the long answer to that question. I think you were next, and then.
Yeah.
Okay.
Oh, sorry.
Speak.
Speak.
Time running
Okay,
out.
she doesn't want to be first, so I'll be first. No, I just wanted to mention something in passing. You talk about the fact that if you have a heart attack or something, you could go to a doctor's hospital and they had specialists and all that, which is not there anymore.
Right.
Alta Base Hospital, about 3 years ago, a person said an emergency on the gurney, brought in by an ambulance for almost 2 hours. That was before doctor's hospital closed. So if you have a heart attack now, I might suggest you just start praying because you're going to die. I mean, where are you going to go? I mean, Kaiser with 12 beds, and they, last time I was there 2 weeks ago, had people out of the hall. So I mean, it's very serious, and I don't think people
So what'll
think about
probably,
that.
right, what'll probably happen, depending on the nature of it, is if you live in El Cerrito, Kensington, part of Richmond, you may end up being taken to Alta Bates. Although, I'm not sure, now whether you would wait that for a heart attack in a serious case, I don't know. Hopefully you wouldn't, and that's obviously an unacceptable amount to wait. If you're out more toward Hercules and Pinole, you'd probably end up going to the county hospital or to John Muir, because John Muir has a specialty for heart attacks and strokes. Kaiser for some, what's going to happen is the paramedic on the ambulance will sort of will according to a protocol, make the call as to where does this patient need to go? How quick do we need? Is it can we provide the medical care in the ambulance versus, when we get to the hospital? Now, one of the things to remember, I mean, there are paramedics on the fire engines except in Richmond. Richmond has EMTs. El Cerrito Fire, Contra Costa Fire, Pinole, Rodeo, Hercules all have paramedics. So, however, there are paramedics on the ambulances who serve all of West County, including Richmond. And so, they will make the determination whether you go to, Kaiser, John Muir County, Alta Bates. So far, what we've seen with ambulance traffic not going to doctors anymore, there's really hard data on where ambulances are going. They're going mostly to Kaiser, Richmond, then Alta Bates, then County and Martinez. So those are the hospitals with Kaiser getting the most. And that's why we thought Kaiser's a nonprofit. We thought, Kaiser and John Muir are nonprofits, and there were hearings in Congress a number of years ago about requiring nonprofit hospitals who get a tax break for being nonprofit to do more community benefit. And by the way, the person who held these hearings was a Republican senator. It was a bipartisan issue of Republicans and Democrats saying, wait a second, hospitals that are nonprofit getting a community benefit should be doing more community benefit instead of the burden being only on the public hospitals. In fact, I can't tell you how many times Sutter Delta and Antioch asked the county to pay them for them to serve people who are uninsured in their emergency room. We're saying, we are spending way more than you on this, and under the law, you are required to treat people who come into your emergency room. So what you have, and this is a nonprofit hospital, so I think that's the interesting sort of issue here is you don't have some fairness in how all of this is funded. So that's the, and again, you'll see, again, what I handed out was to give you a sense of how healthcare is delivered in West County as well. So the goal will be, is you'll see on this sheet where the patients come from at the health center, but there's, while we do have school-based health clinics and mental health clinics, that's all for primary care. The loss at doctors is clearly more for emergency care. Urgent care will get replaced at Lifelong, but there will be no replacement for the lost emergency care services that we are losing with Doctors Hospital closing.
Someone else, back at the back.
Is the county hospital in Martinez certified for strokes and heart attacks? I know Kaiser is not. Doctors was.
Yeah. So, you know, there's something called STEMI certification.
Right. Yes.
For strokes and heart attacks. And the ones, John Muir is certified for that. So it does, the county hospital is not. Doesn't mean it can't treat a heart attack patient. It just means certain types of heart attack patients and stroke patients need specialized care, and it would be better to have them go to a STEMI center. So the only STEMI centers here, I believe that, not Alta Bates, but I believe Summit in Oakland may be a STEMI center, and then John Muir out in Concord. So those two, but the county hospital is not. It does treat some heart attack patients. In fact, actually most of the patients who are Medi-Cal, their babies are delivered at the county hospital,
Right.
West County residents. West County Medi-Cal patients mostly have their babies delivered out in Martinez at the county hospital. It actually does more deliveries. In fact, it did more after doctors closed to deliveries in 2006. So but for heart and stroke, if they're really serious, they're going to go to another hospital.
Back at the back first, and then we'll get to Stan.
Yes, I want to know if there are any plans by the district or the county to do some education for people who use emergency rooms, no matter where it is, inappropriately.
Right. That's a really important point. I looked at a lot of the data. A majority of the people that went to the Doctors Hospital emergency room would have been better for them to get care somewhere else, most likely the doctor's office. Because every physician and medical expert will tell you it's not the best place to get primary care is not in the emergency room. So the education effort is a really important part of this. So as you know, the head of the county's healthcare system, Dr. Walker, is actually president of the National Association of Public Hospitals. And this is an issue across the country about how do you provide education so that you get people who don't need emergency care to the right place for healthcare. And so that's why what's being publicized is this 24/7 advice line, so anybody can call it. In fact, it's great to, I can send this out to folks at this 2-pager. And the idea is, if someone has a doubt and they call and they're told, look, you don't need an emergency room, go to this urgent care center, or we'll get you into a clinic. That way people are being seen appropriately soon enough and less expensive to the healthcare system, and frankly frees up the emergency room so that people who need the emergency care can get treated faster, right? And so that's exactly a big issue, is educating people, all of us, about where do we go for healthcare.
Is there any transportation attached to that education so that people don't wait until their ride comes home to go to the emergency room for a splinter in the finger?
Yeah, that's a good point. I'm going to raise that issue about how we can ensure that transportation is not an obstacle. While there may be an ambulance there to take people, but that's for people who need emergency care, is helping people get to the urgent care center or get to primary care. And transportation would be an important part of that.
Stan?
I remember one time when I had reason to go from Berkeley Marina to Alta Bates for emergency care. And while I was not in an ambulance, it took forever.
Right.
Does Alta Bates have helicopter capability?
I don't think it does. Just so you know, the ambulance, the heliport across from Doctor's Hospital has been used primarily to transport patients who need trauma care to John Muir. Remember, so trauma care, which is a little different, if you're in a car accident, if you have a serious gunshot wound, trauma care is really, trauma center is the place to go. And to be a trauma center, you need a lot of volume because you need specialists who do nothing but that type of work. And these specialists only congregate around these hospitals that have this volume. So John Muir is the designated trauma hospital for this county. So that usually when you saw that helipad in operation, it was taking people not necessarily to doctors, but from here to the trauma center in Walnut Creek.
I was thinking in terms of stroke, especially specific stroke and heart attack issues, where Altabates might be it, and I was wondering if helicopter might be a viable thing, but apparently it isn't.
And I'm not aware that it's there, that you can, right?
Thank you.
Right, yeah.
We have time for one more.
Do they have this in Spanish?
No.
I do, yes. I didn't bring it, but I have this in Spanish as well as in English. And what I could do, I could email the flyer. This two-page flyer is probably the most important thing, is to notify the public. And I could send that maybe to you, and you could get it out. I'll send you the Spanish and English version as well. When I get home, I'll just take my iPhone and I'll forward it to you or something. Okay.
Quick question. So with the specialists from Doctor's Hospital, where will they be going? Will they be going to Kaiser? Will they be going to the county?
When you say the specialist, you mean the physicians?
Well, yes, for a heart attack, and stroke.
Oh, so we're patients. Where are patients who have a heart attack or stroke go?
No. The actual doctors
Oh,
and
okay.
nurses, the
Okay.
staff.
So the physicians who practice at doctors are private physicians who have their own practice. And usually they have admitting privileges at more than one hospital. So they have admitting privileges at doctors, probably Altabates. So they will whether they keep their office here, that's up to them. But ultimately, let's say you see the same physician in San Pablo as a cardiology group there, they will just admit their patients who need surgery at another hospital, like Altabates. The county physicians are employed by the county. The county's, is like a single payer system. So the county has a health plan, physicians. Unlike Doctor's Hospital, the nurses worked for Doctor's Hospital, but the physicians were private practice physicians. Whereas, except for a few that were like the hospitalist and people like that, but all these specialists were private. Whereas with the county, their primary care doctors are employed by the county.
Could we just pause a minute? We don't have any items coming up after this. Would the group be comfortable with giving John 5 more minutes if John would do that?
Yes.
Yeah.
Yes.
I got a sense that. So someone else, questions?
I don't mind.
Yeah, he's a.
We're in a quandary right now, and I'm not sure how we're going to get out of this, and I really would like to hear your recommendations of what we can do.
Yeah. In terms of emergency care, I think it's important being realistic. I don't see any replacement of this hospital anytime soon. One of the things that we tried to do in many states, in fact in a majority of states, you can have what's called a satellite emergency department. So one of the things we were exploring was to actually make Doctor's Hospital just an emergency room tied, let's say, to the county's license with transfer agreements. So if you remember I said at the beginning only 10% of the patients who go there end up being admitted, then you would have a transfer agreement in effect with Kaiser or with Kaiser Hospital, County, John Muir, and all other hospitals said they were willing to do that. But state law in California does not allow a standalone freestanding emergency room. Now, if that law changed, it's possible to try to get a license and do a standalone emergency room, which loses a lot less money, but tie it to the county's license and then transfer patients. So that was one thing we tried, and we worked all the way up to the governor's office on this, and the head of the Department of Health for the state. They just said, you need special legislation, and that would be hard to pass. So that you know, if that ever changes, but ultimately, because I do think the loss is clearly in the area of not having the emergency room capacity, is pushing Kaiser to maybe increase their emergency room so it's bigger than it is. It's only 15 beds. Maybe they will do that. I mean, that's something that, you know, we talked to Kaiser for years about how to partner with Kaiser. It just didn't happen. So, you know, do you have some ability to get them to make their emergency room larger? The other possibility is, I mean, clearly the more robust urgent care, and eventually a 24-hour urgent care will cover that need. But I wish I had an answer to say that there was an answer for the emergency room. There isn't. And in fact, the worry that I have is more hospitals like this around California are closing. That's the problem. And around this country are closing.
That's right.
And so, you know, you would think, you know, there's a whole network of folks who want to change policies. The problem is we're not getting any change at the federal level to make reimbursements fairer to help support these hospitals. In fact, again, we are having struggles at our own county hospital. It's not like we have a deep pocket either. And so that's part of the issue, is how do you get more funding? The reimbursement rates need to be fair.
Someone else? Question over here?
Just in terms of Kaiser, has there been any conversation about maybe Kaiser building a larger hospital here in Richmond?
There were discussions with Kaiser. They have not made a determination to build a larger hospital. We've talked to them. I mean, we've been talking since 2006. In fact, that 8-page chronology I gave you will show you a lot of the discussions, including working with the federal government to see if we could transfer veterans patients here, right? Serve VA, that didn't go anywhere. Merging with another facility, all of that. None of that really panned out.
Kaiser just built a 300-bed hospital right
Well,
along.
Kaiser has built quite a few.
Right.
And it appears that Richmond is the one area that they have not
That's right.
expanded.
I mean, you know, a lot of folks, you know, we worked hard at trying to, you know, put pressure on Kaiser to not close their original hospital here in Richmond, right? When they built the new one.
Right.
You know, Doctors Hospital for a while had a contract with Kaiser, where Kaiser's cancer patients who lived in West County were getting cancer treatment at Doctors Hospital. And that was a moneymaker for doctors. But guess what? When Kaiser built their new facility in Oakland, they basically went back to sending all their cancer patients back to Kaiser Oakland. We said to them, look, we're not even asking for a handout. Keep that, things like that. If you have a contract like that, that brings in paying revenue to doctors. And they made the decision to send their Kaiser patients back to Oakland instead of having them come to Richmond.
As I understand it, Richmond is really a branch of Oakland that operates under Oakland's.
Right.
Right, yeah.
And they probably, as a cost center, you know, it's like anything. It's hard to know which of their hospitals make money and which don't. But remember, Kaiser's like the county health plan. It's a health insurance company with primary care physicians. And their job is to keep you healthy and keep you out of their hospital.
Exactly.
In a way, what's happening is the model of healthcare has changed, where having stand-alone hospitals is no longer a viable model. Think about it. Hospitals make money the more, to the extent they get commercial insurance by having people in the hospital. So healthcare is to keep you out of the hospital, get your primary care. And so the Affordable Care Act, actually, that's why it's causing this integration of health systems, physicians combining with hospitals. So the county system is the same way. You know, the healthcare clinic across from doctors actually sees more patients than Doctors Hospital. It has 80,000 patient visits a year, the health center. If that health center weren't there, and we worked hard, got a $14 million grant from the federal government. We added, our local funding was a $40 million facility. If that facility wasn't there, even more people would be going to the emergency room, right? So that's really, the future of healthcare more and more is, also getting your healthcare through email and phone, so you don't always go into the hospital and communicate with your physician. So you're seeing more of that as
Yes.
well.
We have to now shut down and thank John for his time.